Good morning to one and all. And if you have a sitting job and if you spend more than 6 hours a day sitting at your desk, whether you're working from home or from the office, then you definitely need to watch this. I'm your host, Dr. Shumayu Datta. I'm a spine surgeon, and more patients come with the complaints of pain in the back. And these are the younger group of patients in their 30s and their 40s who've just joined the workforce. And today I'm going to share with you a shocking chart that reveals the truth about why are we seeing so much increase in back pain rates, especially in the young group. So I'll first start with showing you how the spine looks like. This is uh, this is the model of a 3D model of the spine, and you can see the bones. These are known as the vertebrae, and between two, there's a soft jelly cushion called the disc. Now, this is looking at it from the side. This is the front, this is the back. You can see the discs in between. Now, when we sit, we essentially load the discs. So we put pressure on the discs. And when we lie down on the bed or when we're standing, the weight is evenly distributed between the front and the back of the spine. So the discs come under normal pressure. But since sitting is always a little bit forward bent, the disc comes under pressure, which is in front. So what happens is when you're sitting, you're pushing this whole structure in front. And as a result of that, the disc comes under pressure and it squeezes a little bit. So let's take a look at a chart that tells us exactly what's going on with the disc when we're sitting. So this is a chart showing us the intradiscal pressure, meaning the pressure in the disc with different postures, different positions you are in. So for example, when you're standing, which is the most natural position that comes to humans. When you're standing, the disc is loaded to 100% of its maximum weight bearing capacity. So 100% loading when you're standing. Now, when you lie down, it's only 25% of its maximum load bearing capacity. So you'll have noticed if you ever have back pain, lying down is always comfortable, and that's because you're offloading the disc. Now, let's look at what happens when you're sitting. This is a normal person sitting with good posture. It's 140% of its maximum weight bearing capacity. And if you're sitting slouching and bending in front, then it's around 300%, which is 3 times its designed weight bearing capacity. So, as you can imagine, if you're sitting in one of these positions, if you're spending many hours a day sitting, or if you're not using an ergonomic chair, or if you don't take frequent breaks, if you're doing Zoom meetings back to back, you can imagine what is happening to your discs. Now, eventually, when the disc is under constant pressure, it starts losing the fluid inside it. And the fluid inside it, the gel inside it, is extremely important when it comes to mobility and strength of the back and keeping pain rates low. So, when you start losing this gel, when the disc starts dehydrating, that's when most people start developing back pain. So sitting is the new smoking. Sitting is very bad for your health. Continuously sitting at a stretch is the worst thing you can do. Some easy hacks, if you do have a desk job, is to take frequent breaks every 45 minutes or every 1 hour. Just get up, uh, have a glass of water, sit down again. Just stand up for 10 seconds, sit down again. Just do some movement. The second thing you can do is do some basic mobility exercises while sitting itself. For example, I'm sitting down and I can move my shoulders back. I can turn my head left and right, do some rotations. I can stretch out fully and stretch to one side, followed by stretching to the other side. Clockwise, anti clockwise movements, hands by your side, and push back your elbows. So, all of this is very good for the neck. Just standing up, just standing up, doing some pelvic stretches is also really good. Uh, these are simple hacks in which you can deal with this. But Having said everything, sitting for more than 1 hour at a stretch is very bad for you. Be aware, because a degenerating spine will not, a spine that is under pressure, that is slowly, the disc that is degenerating, it's losing its fluid, will not become symptomatic for a long time. And when it does become symptomatic, it's often too late to start these changes. So I'll see you at the next time. Take care of your spine. Till later.